Good morning. Welcome to Wellness Wednesday. I'm Deborah.
And I'm Rachel.
And today we have Red River Pharmacy with us. We have Tracey and Tara.
Yes.
Correct? Okay, yay, I got it right. When you get older, I'm like, she just told me her name. So, Wellness Wednesday, we just kind of bring you guys in, kind of talk about what you do and what you do for our community. Red River Pharmacy has been in existence how long? A while. I know it used to be on College Drive.
Yes.
And y'all do compounding. So now you're out on what's the name of the road you're on now?
We're on Moore's.
Moore's Line.
Yeah.
I don't know why I want to call it something else. I keep wanting to call it Galleria or something else.
Right.
So
on the end of Moore's, yes.
moved to a new building because you needed to expand.
Mm-hmm.
Because I know that building was pretty cramped full. Because I used to go over there when I was with another company. So you still do compounding.
Yes.
You do infusion.
Yes.
Okay, so just take it. Tell us all about it.
I was talking to Rachel. Long-term care is part of our pharmacy, and Daniel Ludwig is our account manager for them. I don't know if you've met him.
I have. It's been a while.
He does a great job with that. So he takes care of that, and we do the medications for skilled nursing facilities. I don't know if you have been familiar with that when you were at.
Yeah, we dealt with somebody out of Longview or Tyler.
Okay.
Yeah.
Well, not all of them, but
because it was a corporate, and that's who they chose.
It just
not
depends.
because it was
right.
Again,
but we do take care of a lot of them, assisted living, so making sure the residents get their medications. But Daniel takes care of that. So, and then we've got our compound pharmacy, and we do. There's a lot going on in that pharmacy. There's a lot going on under that roof. Like when I did my interview, when I walked in, I was like, oh wow, there's a lot going on. I was like, let me be a part of that. So, compound, we take care of patients, or in the community, as far from family medical and geriatric all the way down to your dogs and cats with compound. I mean,
really?
Yes.
I did not know y'all did it for the
we
animal.
call on veterinarians.
I probably need to bring mine over there and let y'all diagnose their issues.
We can do something. We've got something for everybody in compound.
So why would a person need compounding versus just taking an oral?
Well, the benefits really are a lot of times cost, and we can customize the medication to the individual patient. So if there's allergens, if there's something in it that they don't need, they can take it out, and they can just adjust and do different formulas of that medication to benefit the patient.
So how do you get to the let's say I go to the doctor. I don't like taking that. Can you make it where it fits me? Do they need to ask the doctor, or does the doctor go, no, we're going to do this in the compounding?
Both. I educate the doctors obviously about all the things we can do. So, but we also love for the community to know, and then they can ask. But they would call over and send an order. They would call our pharmacist, and a lot of times they'll just call the pharmacist for recommendations. Say, hey, this patient's in our office. This is what's going on with them.
What can you do to fix this issue?
What formula can you concoct to?
That's
help
a really.
them. Yeah,
I
really
worked
neat.
with a pharmacist, not a pharmacist. What do you call them? A lab? What are those?
Pharmacy tech?
No, a person that was a chemist, I guess.
Oh, okay.
My brain is not. We usually do this in the afternoon because we're neither one of us are morning people,
Right.
and hadn't had enough caffeine. But yeah, a chemist does it basically. You gotta be. You gotta be really, really, really.
We
smart.
make jokes about Breaking Bad in there sometimes.
Got it all going on.
Right, no. That's a joke.
It's a joke.
It's all legal. But yes, they do a lot of things in there to for patients, we can make things into creams and ointments.
Oh, yeah.
If they have trouble swallowing medication, we can add flavors for the kiddos. We do a lot for the kiddos.
That's a good one.
But yeah, orthodontists, dentists, we do mouthwashes.
I had no idea.
Yeah.
You're just doing a little bit of everything.
A little bit of everything.
I know
So.
y'all also do hospice.
Yes, so that's a good point. With the compounding, we have great relationships with the hospices in town, and we help them get their medications to keep their patients comfortable. So a lot of times they can't, they're getting to where they can't swallow, or their esophagus is burned from radiation, and they need, ointments and creams or the IVs. So
I know we utilize y'all services quite often.
yes, and we make the medicines available 24/7. So,
Yes, you do. Yes, you do.
Because
we
never know when you're going to need them.
Well, in the middle of the night, there could be a crisis.
That's
so
right.
That's always good. So, Tara,
Yes.
what do you do there?
I am with Red River Health inside of the pharmacy.
Oh.
So technically a separate business, but we have the same owner. And I'm doing outpatient infusions for patients with chronic or autoimmune conditions.
Okay. So, what is it? Just here that you do that, or y'all have other locations? Correct.
Right now, it's just the Texarkana location, and hopefully Jonesboro, Arkansas, by the end of the year.
So, how far do y'all go out in this area?
Well, the patients come to me.
Oh, so they actually come to
I
the
have
building
it-
and you do it in the building?
Yes, I have an infusion clinic at the pharmacy.
Okay, well that's neat. That's
Yes.
very, very good for the community.
Yes.
So how long, and go back, so y'all have Red River here, but you have other locations.
Yes, we've got Jonesboro, Little Rock, here, and Tyler.
Is it all owned by the same person?
Mhm.
And the person lives here?
Mhm.
Oh, cool,
Mhm.
cool.
Yep.
Oh, that is neat.
Growing all the time, and we're about to outgrow that building we're in now. so
Seriously?
yes.
Wow. How long have you been in that building? It hadn't been,
3 or 4 years.
I was gonna say, it hadn't been that long.
Yeah.
So it's locally owned, just like us. We're
Yes.
locally owned, so that's a good, that's a
It
good,
is.
good
It's
thing.
a different
Um,
atmosphere.
Because decisions can be made.
Yes.
Very quickly.
Yes. It's a yes man company. Like I love it. That's one of the things I love about it. Is
Well,
let's
you're
figure
able to do your job,
out. Right.
and there's not the limitations, I guess.
Right.
Because
You're
with
not
us two,
delayed as much,
with us
yeah.
two, we're like, why can't we? Why not?
Right. Right. And
But tell me why? Why?
Well, yeah, one of the first things I went to VIP of infusions, and her response was, "Well, let's figure out how to say yes." And that's when I knew I was like, I'm gonna like this
I
job.
gotta like
Yeah.
this one because I met you when you were at Encompass
Yes.
Rehab. So I've known you for a few years.
Yes.
First time to meet you. So
Yes.
nice to meet you. Now you are a nurse
Nurse
practitioner.
practitioner. Mhm.
Okay, and you are
Well, I'm a respiratory therapist.
okay. I never knew that about you.
Yes.
I did not know that
I
about
am,
you.
but I have been marketing in some kind of medical for 20 years. So
You're not
They
old enough
kinda
to be in the
sat-
industry 20 years.
yes, I'll be 50 this year.
Are you serious?
I sure will.
I need to know your secrets.
Oh, well, thanks. You're my new best friend.
I'm serious. I just turned 59 and I'm like, oh Lord
Oh,
Jesus,
gosh,
get the
you
lights
look
off
great,
me and let's.
too. Whatever.
Moving
You're
on.
beautiful, so.
Well, thank you. You're very kind. So, what do y'all do out in the community? I know y'all partner up with us some and do things like that, but as far as getting this information to the community, how are y'all able to do that?
A lot of, I mean, on my part, it's just hitting the clinics, hitting the hospitals, places like that. We do some health fairs and things like that. We've done several health fairs since, especially with this, since it's new. It's a great resource.
Oh my gosh,
And
yes.
patients are having to travel, like, if they see a rheumatologist in Shreveport or Plano, then they're having to go back there to get that infusion, and that can be quite often. So we're trying to do as much as we can in the community to let them know that they can stay local
Here locally, you don't have to
still see
travel.
that doctor, but they can stay here and get their infusion.
That's
So
good.
I feel like that's a great resource, and I'm hoping this helps to get the word out.
Absolutely. That's
Yes.
our whole goal is,
Yes.
to let the community know what we have
And
right
she
here.
started a website, Red River Health.
Oh, really? Okay.
So
I'm gonna go
y'all get on there, like
it,
it,
and
follow
we'll go-
it.
Yes.
Yes.
Red River Health. I will go look for it and,
Yes,
and
we're on
like it.
social media, Facebook and Instagram, and then our website is redriveraic.com.
You may have to write all that down.
Yes.
I do good to remember a name. So sorry. It's that I've reached that. I think my brain is at full capacity. It says you got to delete or.
And then, I'm sorry. And then I think she was we're having a blood drive.
Yes,
Sometime.
and May 23rd, Red River Pharmacy and Health are hosting a blood drive from 12 to 5. So our goal,
May
23rd.
23rd. You heard it here. Blood drive at Red River. We're getting into that season that it's going to be necessary to go out and give. And I think they always give something away when you
Yes.
either T-shirt, something.
They gave us the promotional material already. It's going to be a tumbler that's got the handle on top to carry it, like a 30-ounce tumbler.
Oh.
They're like turquoise blue. They're very
Oh.
pretty. Yeah.
Cool. There you go.
Another
May
good
20
reason to come.
Right. May 23rd is going to start at what time?
12.
12 p.m. Go have your little lunch. Go give some blood.
Yes.
That's
Yes.
good reason.
Oh,
Be
that's
part of
good. Eat lunch first.
Because I have a tendency, I don't do giving blood well.
Yes.
Even if I eat everything, I end up getting very lightheaded.
Not feeling good.
Yeah, I mean, no matter what I do. So it's like, and plus I'm a hard stick. I'm a hard,
Oh,
my
that's
so
veins roll.
Yes.
Yeah,
Yeah.
I inherited that from my mom.
I'm the
So-
same way. They always say, "Oh, they're little. They can't." Yeah.
Oh no, they go, oh, you got great veins. And I go, where to go? I'm like,
Right. They're shy.
Peekaboo.
They're shy.
Well, guys, I mean, this is great having you here today, but we want to learn a little bit about yourself. So
Okay.
you're from this area.
Yes, born and raised in Texarkana. been married for 25 years.
Wow,
next
and you still
month.
like him?
Yeah,
Most
sometimes.
days?
Most days.
Okay,
most
well,
days.
you know, that's okay, 25 years, that's huge.
Yeah, I mean, I'm in it for the long haul now.
Yeah, you don't want to retrain another
No.
one. It's not worth it. You don't want to start. You want to start at the beginning.
Right.
And you have how many children?
We've got 3 kids between us, and a 2-year-old grandson, and one on the way. And when I say one on the way, any minute now, any day now.
Ooh, she may get a phone call.
Yes, another grandson.
Aw.
So yes, we've got a busy year. I've got my son's graduating college, and then he's getting married on me. She's graduating college in May.
Wow.
Grandbaby coming in May. Then I've got a wedding. He's
Okay,
getting
guess what?
married.
You are busy.
I know. Then he's getting married on me in December, and then I already said I'm turning 50. It's a
2024 is really going to test your patience.
It is.
And making you not go crazy.
And I've got my youngest is in nursing school, and whew,
I remember those
need prayers
days.
for that.
I remember those days.
She needs prayers, but so do I. So
Yes, I would get that phone call. I don't think I'm going to make it. I'm like,
yes.
you're going to make it.
It's
You're
so
fine.
hard. I'm
Yes.
like, you can do it.
And
You
she
can
was
do it.
5.5 hours away from me. I'm like, you've got
Oh,
this. You're
gosh.
fine. Just focus.
Wow.
So, yeah.
Wow.
But anyway,
But she's got a lot going on too. So,
I know.
share. Yeah, yeah.
Good.
She's pregnant.
Yes. So I'm the nurse practitioner at Red River Health. I've been married for 10 years this year,
Oh,
so
wow.
not quite 25, but we're on our way. We have 2 little boys and a 3rd baby on the way, and it's going to be a surprise. So we don't
Aw.
know the gender yet.
Not till the day
She's
comes.
driving
and
me
says, "Hey, Mom."
crazy because I'm ready to buy stuff, and I'm like, I guess I'll get green or yellow.
When are you due?
June 16th. So.
Ooh, almost when it's
Almost.
unbearable heat.
Yeah.
I had my daughter on June 20th, and I thought, oh, Lord, 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 Lord. And she was 2 weeks late. I kept going, you need to come out.
We're done.
Your eviction notice
You
has
got
been
2
served.
girls?
I have one.
One girl? Okay.
She's like having 2, but I only have one.
Oh, I know them girls are like, they're extra.
She's actually a nurse here with us, so.
Aw.
I didn't know that.
Yeah.
Okay.
She's been
I'll
here.
have to meet her.
I don't know how long she's been here. For a while.
Yeah.
She was actually sitting in this chair. I made her move.
Oh, that's all with the cute.
The little thing. She does.
Didn't know
She does all
that.
this stuff with her hair, and I'm like, "Ooh."
Wow.
She goes, I looked on
That's
whatever
why I
it is,
noticed her hair was cute.
and I'll go look at it, and I'm going, I can't do that, or I'll try to do it. And I'm like, yeah, that don't look like that.
Yeah.
So, but well, guys, I mean, this is awesome. We have a locally owned company, Red River Pharmacy, compounding, infusion, in-house infusion.
Right. And we also work, like when I come in and do the in-service with you
Yeah.
guys, we work with the home health for home infusion too, for IV antibiotics.
I know we've
Yes.
had some home health patients come in,
Yes,
and y'all
we
do
work-
the education
yes,
on that, which
yes.
is
We rely
awesome.
heavily on the home health to take care of these patients. So we provide the medication and the education, of course, the support for you guys, but then y'all take it from there. And so we couldn't do it without the home health for
same,
sure.
same.
But we do TPN, which is the IV nutrition.
Yes.
So patients.
Is
get-
that really a lot going on in this area? I know in the nursing homes, there was only one here in town that did it.
I wouldn't
Is
say
it
it's
hit
a
and miss?
lot, but it kind of comes in spurts too. And then we get a lot from like the Dallas area when they go to see GI specialists to different areas. But if they're not able to digest through their stomach like normal, then we do the IV.
Does that happen?
Nutrition.
Now I'm jumping off into the deep end of the pool because I'm just curious. When you have a surgery to lose weight, God, does
Yeah.
that have a lot to do? You end up on something like that because of the nutrition, or can you end
You
up on that?
can if there's complications because
Okay.
I've seen that.
Okay.
I don't think that's not what it
That's
obviously
not
it's
common.
That's not
No.
common,
Yeah.
and that's not what was meant to happen, but it has.
It does
happened.
happen.
If
We've
it-
ran into it in our
If
industry.
right. If it messes or there's complications down the road, then
Well, we're seeing more complications from people that had that done 20 years,
Years
30
ago.
years ago,
Right.
not current.
maybe when
I'm sure they perfected it.
hopefully.
Yeah.
Yeah.
You
But
never
yes,
know.
And then we do some of the IV infusions at home for patients with immune disorders. We can do some of that at home too. So.
I know we do infusion, and Rachel can actually talk on that better than I can because that's not
So our infusion program, what we are able to give, it comes off of we call it the hit list.
Mhm.
So a lot of the cardiac drips, like we have a few people now that are on service that all we're doing is helping manage their cardiac drip once a week. We go out and do their PICC line changes for them and communicate back and forth with their pharmacy. We don't really ever get the referrals from physicians. They come from pharmacies, and most of them have been out of the Dallas area, but like people waiting for heart transplants and things like that. We can do some autoimmune things too. There's some vitamins. It's not like when I look at the list and I'm a nurse, it's nothing on there is one of those that you say, oh, that's a very common,
Right.
So we don't see a lot out of the Texarkana area. It's more out of Dallas,
Right.
but there's no time limit for it. So like with home health, we run in 60-day, cert periods with our IV program. There's no set amount of time that we've got to come back and say, okay, you got to come off. And we're also not chasing doctors back and forth for orders.
Right.
It comes right from the pharmacist. He sends it and says, or she, this is what they need. So we're not having to do a whole lot of paper chasing for it, but it kind of helps us be the in-between for the patient and their doctor and pharmacist to kind of knock that out, because what we've seen is a lot of these people have been stuck in Dallas when they've wanted to come home, in their downtime. We've had one lady, she's probably been with us 7 or 8 months now, that had been staying in Dallas because she couldn't get her what she needed here.
Right.
So she had puppies and stuff, and she's fairly young, and she was wanting to be here in her surroundings with her puppies, and so she's gotten to really get a little bit of her life back in the meantime. But a lot of the drugs, I've had people inquire and ask about the new dementia drug. Do y'all do that one over there?
We do.
Okay.
We can be.
So that's a good thing to know, because we've
yeah.
had several people inquire about that. A lot of the physicians that I've gone in and, talked with, that's a hot topic.
They're asking about
Yeah,
it.
they're
Yes.
asking, and they're wanting to know if we can do that with that program. And we can't do it with our transfusion program, but if they will write it, then, we can do it for home health. But that's one that people are asking me about. I also had somebody ask me not long ago, she has an autoimmune disorder, so I did direct her to you guys. I bet she is probably seeing you guys now, but she had a very hard time helping her to lead her in which way to go.
Yeah.
So a lot of those drugs, you don't really know what they do or what they're for until you're in the position of, hey, I need it.
It's a need
like, where
situation.
do I go from here?
Right,
So
Yeah, so the Alzheimer's drug is a new drug that's FDA approved. I will say that it's likely that a specialist needs to prescribe it, like a neurologist.
and that's who talked to me about
and
it.
there's a lot of insurance requirements to get it approved, so that's
I
why
can
you
imagine.
want someone specialized in
That
what
can
they're
actually
doing.
Make sure they
Yes, because there's
dot
lots
that,
of
cross
Right.
the
yes.
And she
T's.
takes care of all that and does
Oh,
a
do you?
phenomenal job. Like, she knows.
Yes.
And I didn't really get into it real deep with him, because I wasn't able to just, I can do that in the home, but I would imagine those people are still pretty early in their diagnosis.
Yes.
So they're still able to either drive themselves to you guys, or somebody's,
Yeah.
it's not for somebody that's gonna be
Late
yeah,
on
we need
that.
to start it very early.
So what do they think that this is going to do for them?
It does not cure Alzheimer's,
Slows
but
it
it can
down?
slow it down, can
Gotcha.
slow the progression of memory loss down. And I
So
don't know
probably
that
need to
there's
get on
any.
it now.
Yeah.
And there's a lot of follow-up with it. There's
Mhm.
like certain scans and things
Yeah.
that have to be done at certain intervals, and of course with any medication there's certain risk of side effects and things
Oh,
that
yeah.
have to be monitored for.
I'll give you a list of that, and you're like,
But I don't know
"Oh."
about other people, but if I had Alzheimer's, what can you
Well,
lose?
I mean,
What's to lose?
what's-
I mean,
roll the
that's-
dice.
Roll the dice, right.
So I've just recently actually on like Ozempic, have y'all seen all the
Yeah.
like the negatives and the goods? But one of the things that I've read recently on Ozempic is that it helps with Alzheimer's,
Oh.
like not to make it worse or try to improve after where
Maybe
it's
slows
bad,
down.
but it's one of those things that they have seen has benefited people. Yeah, and then I ended up in I'm a rabbit. Whole chaser. So I ended up from where I saw the Ozempic was helping with that. I saw where they've started this new therapy for people with dementia and Alzheimer's that was really neat. I don't think I could do it. I would I'm too clumsy. But it's like they put people on these boards and they stimulate your brain in like several different areas. So you're on like the motion board that kind of does this, and then they will set cones out for them, and they step in between the cones, but they have lights out in between each cone, and the lights will go off when they're supposed to step and move. So you have all these things,
wow.
stimulating, and you're still doing this, and they're showing like huge improvements. With
So is that
people
only
early.
in the early stages? Because I
Mhm.
can't imagine later
Yeah,
stages
no, it's
that
for
working.
early, but they're
Right.
showing huge improvements in people.
I have seen stuff about music too with
Mhm.
Alzheimer's. And
Yeah.
Yeah, it was.
I went through a training at UAMS for dementia, and the things that it was in, I was like, I would have never thought
thought of
that.
that, right.
I mean, you, like going to the bathroom. We just go to the bathroom, but when they go, it's like a dark tunnel. So they recommended painting one wall a different color so it separates them, so they don't feel like they're being falling.
Yeah.
So I was
I
like,
don't know about
okay.
y'all, but it seems more prevalent every day. Like,
There's
it's
more
crazy,
people
yeah.
diagnosed with it every day, and I
Younger too.
right, and I'm on up there, so I'm like, woo. And some days I'll talk to my husband, I go, you might have it.
Right.
'Cause but he's been a repeater all his life. He repeats there. I go, you told me that yesterday.
Well, my daughter tells me all the time, Mom, you scare me. I'm like, I scare myself. I cannot remember.
No,
Sometimes
that's just
words,
busy.
remembering how to
I
pronounce
think so,
words
too.
has become more difficult as I get older. I'm like,
Yeah.
good
What
God,
was-
that can't be that hard. I'll go, I haven't arranged, but it comes out my mouth, and I go, that's not what I was trying to say. But
But when you were talking about getting patients home, that's the great thing with working with you guys and us. We're getting those patients home where it's more costly, less costly. My bad.
Yeah.
It's
cost effective.
more cost effective. It's convenient. It's comfortable.
Family,
We're
home.
helping the hospitals to get them out
Mhm.
in a timely manner. So I think us teaming up with you guys is
Absolutely. We have an umbrella, a plethora of things going on, and he seems to add to it on a regular. So, I
Right.
mean, since I've been home health, hospice, inpatient unit, I don't know if y'all knew that, non-emergency transport, ALF,
Palliative
infusion,
care.
palliative care.
wow.
We have a plethora of, not
Right.
most home healths and hospices have that underneath their,
And then that cardiac, y'all have to be certified.
So with our IV infusion, yes, you do.
Okay.
And it's a lot of people just throw them all together with home health and the IV program, but they're very different.
Okay.
So we could actually have somebody on our IV program and then be on home health at the same time. So, all of the nurses have to go through the official training for
Right.
that
But
when
only
they
certain
start.
home health. Not everybody does.
Right now, we're actually the
the
only
only one.
home
Okay.
health in the area that has the IV transfusion. So, and you have to.
We provide medications for cardiac infusions. What are some of the medicines?
Girl, don't ask me. Because all of their names are
There's
like
a lot.
this
I
long.
know.
Yeah.
I know. I shouldn't
I
have said
know
that
them when I
'cause-
hear them, but I mean they are. When you get it, you're like, okay.
Milrinone, is it Milrinone? Anyway, I was asking about that the other day, and they were like, yes, we provide the
Mhm.
cardiac medications for that.
Which I would assume.
And the pump and everything that
I would
goes with
have
it.
to
we can-
think that I haven't really ever asked, but now that you said it's made me think. I'm not really sure how they get their medicine. A lot of
Okay.
times, if they're shipping it to them, or if
Right.
maybe the
A lot of
pharmacy
times when they're
there
coming
is
from
sending it
Dallas,
in here,
it's
or
getting- but we do
you know how
provide
it.
the medications for the cardiac infusions, the pump. The
I need to
medicine.
ask on that because I haven't ever really thought about how they're getting their medicine there to them.
Because you get it from us. That's where you need to get it.
right? We've got a non-emergency transport too. We have that.
Oh, yeah,
gosh,
no,
y'all
you
do
said
do
that.
I did say that. See, Brain.
When did you start the inpatient?
The
It opened in
inpatient.
September of last year.
Okay.
Yeah, so it's 12 bed, or we have the capacity for 12 beds, and it's inside of our assisted living. It's kind of on the side of town where it's not really busy. Once you get on that hallway, it's quiet.
Right.
I like to go over there and check in with them, but I can't stay there all day because I feel isolated from the world.
Right.
I guess you would know, y'all know after you have been from either working in a facility or, in an office, you're very content with that until you get out.
Right.
And I always
You get
tell them I'm
free.
like an outside cat, just give me a little place to get warm
Right.
for a minute and draw off and then we're okay. But it's very quiet. It's very home-like. Each of those rooms are set up like bedrooms
Nice.
or apartments because essentially they are assisted living rooms that we have just made into the inpatient unit. But we do IVs over there. Like I know, you guys are who we use to get our medications in over there. So we're taking people in that are getting pain management and things like that with IVs, and then behaviors. This seems to be the time for behaviors right now.
Yeah, the seasons are changing.
Yeah,
Yeah.
it's getting warmer, and our internal, we know,
Yeah.
like we get that itch
Yeah.
to want to get active, so we know. But we can help with behaviors, nausea, vomiting, you name it. Like, it's really just a hospital for
Yeah,
hospice
that's
people,
good.
basically. So anything that we can alleviate a symptom for, then we're gonna take care of over there.
That can't be managed in the home.
Yeah.
That's
Yeah.
the,
Right.
and that, a lot of people get hung up on that, but,
Yeah.
some of the other hospices that don't have an inpatient unit, it's like night and day,
Right.
like night and day.
If it requires skilled nursing for 24 hours, then yes, 100%, you come on in, we're gonna get you managed. And,
Right.
you know, we see people come in and walk out. We've
Go
had
back
people
home.
come in that were, you know, rocking with pain and couldn't sit up, and, you know, they've riding a bicycle,
Right.
you know.
Correct.
I mean,
Yeah,
we-
or playing the
we've
piano
seen
the
it
next
all.
day
You
after we got
just
their pain
never-
under control.
Yes,
Yeah.
that's amazing. Yeah, that's awesome. That's
Yeah.
good.
You never
For sure.
know, but
Yeah, each room, and there's different sizes of rooms on that hall.
Mhm.
There's, you know, because some people don't have a large family and some do.
Right.
There's a family room that they can come in and have coffee, have family time. There's a dining room table, couch, that kind of thing.
That's nice.
There's snacks in there for the family, refrigerator, and the nurse station's right there.
We'll have to come over and tour it sometime.
I think you need to. I think it'd be awesome.
have you
Yeah.
ever gone through the assisted living? Have you been in there? Your drivers know it, like the
Right,
background.
right, yeah.
They're on a regular.
And there's one that when I've been over there, he always has a funny joke to tell. Like every
I love
time
our
I'm in
drivers.
there, he comes in
Oh.
and sets something down, and then he waits for everybody's attention, and he tells a joke before he leaves.
That's
I miss
so
that.
funny. I mean, I love our drivers. They're amazing.
Yes.
They're I don't-
Sweet.
Yeah, they're sweet and they're comical and they're I don't know.
You can tell they enjoy what they do.
Yes, that's they
That's
they
the
love
key.
what they're doing.
You gotta like what you do.
I've got one that likes to jump around the corners and try to scare me.
Oh
when I'm
no,
up there all
he'd
the
be
time.
fired. Look, I'm out. He'd be fired. Okay,
Yeah,
I'll
I'm
do
doing
this.
that.
That or in the hospital after
But when
I.
he's not there that day, I miss him. So
Aw.
yeah, they're it's a great bunch. So and
So-
they do love what they do.
How many employees does the local Red? I'm asking really.
Ooh,
Red River Pharmacy employ?
I don't know a lot. I mean,
100?
each pharmacy has.
The whole team.
I mean, it's a pharmacy, but then they talk. You know, it's this pharmacy, and then there's several pharmacies inside one pharmacy.
I guess
So
80 to 100
Okay,
would be my
okay.
guess.
That's
because I did ask one time how many pharmacists, and I think it was 20 plus.
Yeah, that would make
Just
sense.
So-
pharmacists.
what are the shifts like at Red River? Because you're around the clock.
It's different for each department.
Mhm.
Okay.
They take call. They rotate out the pharmacist and nurses and techs rotate out call and.
You don't stay
don't really
in
know.
there the whole time. You go home and somebody will call you and go up there, right? Is that
Yes.
like the night shift? You get a
Yes.
call out.
Yes. Yes.
Yeah, okay.
Yeah. That's how. And we are open on Saturdays
Oh.
for a little while for patients to come pick up medications but yes, there's always somebody on call. And they'll I know long-term care and home infusion, and they'll come up there.
Yeah.
Mhm.
I know for
And
hospice
get
they do.
whatever ready for yeah.
Yeah, that's good.
Yeah, it's
I
really
mean,
neat with the hospice because we have it set up where each hospice has their own section or
Locker,
locker or something, and so they
So, like-
can come up there. They have access to their
what they need.
patients' medications.
Oh.
Yes.
And it's really awesome that Texarkana does have a pharmacy willing to open up, like, you
Mhm.
know, a hometown pharmacy, because, other hospice companies that I've worked with, and they did not have, like, we have one set pharmacy that we use, and we take our medicines out to our patients. With another company I was with, they used whatever pharmacy they previously used, and
Right.
then the patient or their family were responsible for going to
And
get
you
their
got
meds.
different rules, different ways of doing
Yes,
things.
and
you're
then
trying to
if
keep
it's
up.
middle of the night and you're trying to get somebody comfortable or deal with medicine, then you are stuck on the phone calling around trying to find a pharmacy
Right.
that can fill what we need or whatever, and being able just to make one phone call.
Right.
Most of the time our nurses, you know, they'll call Dr. Mayo on the way out to get something going, and they normally go through and pick up the medicine and deliver it to the patient, you know, middle of the night or however. So that's a big thing that people don't really know, that is a benefit
That's
of
going
having
on.
locally owned companies working for you, because if
Because
you're
not everybody's an 8 to 5 business.
No.
And that's,
Right. And it is very family. That place is a big. It's like a big family, but they also consider the community
Mhm.
and the home health and the hospices. That's part of the family, so they want everybody taken care of.
that's
That's the
awesome.
way I feel.
Well, we need more people
Mhm.
looking to help the community and do
Right.
more for the community. Because some people don't have the privileges of,
Right.
you know,
Right.
am I going to pay for my meds or am I going to eat this week? Or,
Right.
you know, let's see.
Right.
what we can do to make it
I've
better.
seen those pharmacists and those, the intake, they bend over backwards trying to, like I said before, trying to say yes to the patient, trying to get them what they need. So,
And if they're going home on an IV, because I catch this a lot coming out of the hospital, I know Red River has been really good about working with people to get their medicine, because some of those co-payments and stuff are very costly.
expensive, yes.
So I know, I'll go in and talk to them, and a lot of times they're hung up on their discharge side just because of medications. So that it is a huge problem.
Yeah.
I know not only in our area but everywhere.
Yes.
Medicine is a real deal when you don't have the funds
I don't
to
know
get
what
what
all the
you
ins
need.
and outs back there of what they do, care payment assistance. I know she does
Care
that, some
credit.
care credit and stuff, but
There's gotta be grants that
I
can
know
help you
that
with
they don't just say, well, sorry, you can't afford it. Sorry.
Sorry, I don't know what to tell you.
They, every avenue to try to get the patient taken care of, so.
Well, I know in home health, I ran into it yesterday. Home health is really, they don't take care of medicines. It's just short-term education, get up home. But I have a little gentleman, God bless him, he is non-compliant, but I think part of the problem is he doesn't know how to communicate what he needs. And I spent quite a bit of time with him last Friday, and he hasn't had his meds. So I went and got his meds yesterday. I'm like, we're gonna figure this out.
Right.
You're gonna get in compliance.
Right.
He'll just call and goes, nobody's calling me back, and I'm like, about what? And he
Right.
goes, well, what y'all were talking to me about? I'm like, what were we talking about? So I just go, let's
Yeah.
break it down.
Yeah.
Let's break it down. What are you needing? And come to find out, all his meds.
Right.
And
Every
like-
patient's different, every
So now
living situation. I mean, you just never know what you're gonna
you run into.
get and what you have to do to help them, but.
It's that extra step that helps somebody get in
Right.
compliance or educate them on, you're gonna end up back in the emergency room if you keep on this path.
Right.
You had a stroke, you gotta take your medicines.
Right.
They're not just for fun.
Yeah. And unfortunately, cost does come into
It
play
becomes
with
a
that kind of
huge
stuff.
factor,
So,
but I mean, the thing is, his was paid for, except for a
Oh.
couple of them.
yeah,
Nothing's,
he's one of the lucky
but
ones then.
the thing is, he's hard to get a hold of. And I said, well, our trick is we knock on the door and he leaves it unlocked and I stick my head in and he goes, hey! I'm like, see, you're here. So, but, pharmacists don't always do that. They're delivery people. So I said, we're gonna figure this out.
Right.
So today I'm gonna deliver his meds.
Right.
And then go from there.
Right.
We're gonna get a plan.
Teamwork.
Makes the dream.
It does.
That'll make your hair fall out.
So I did see last night that it is National Stress Relieving Month.
You need that.
I'm
What is
telling
going
you,
on?
It is National Stress Relieving Month. I said, how do I find this
Coming
out
up
when
in May
April
or
is?
this?
Oh, no,
In
right
April?
now.
We're almost at the
just find
end?
it out.
Yes.
Yes, I wish I'd have known that.
Well, we
April
needed to
1st.
know it at the first.
I know. So now I feel like the whole rest of April I need to figure out how to.
Right.
Wasu?
De-stress.
Yes.
Wasu?
Yeah,
That's funny.
that's what.
And
it
then
is.
Nurses Week is coming.
Oh my
up.
gosh. I don't know about y'all, but we've been
We're
out.
gonna be busy.
Yes.
Mhm.
And Nursing Home Week, nurses, and then CNAs in
In
June. So
that time of
Mother's
year.
Day's in May.
Yes.
Guys, Mother's Day. Mark it on your calendar. What day is it?
May 12th.
Neck.
Oh, look at you knowing
Neck
already.
is
May
empty.
12th.
My neck is empty. Just hitting
Oh,
it.
her neck is empty. They have some good
Good
sales.
bracelet. I don't know.
Right.
You know, Crockers will do you can go in there and do a wish list, and they will send the hints out to your significant other. Did you know
Yes.
that?
My husband's going, how'd they know that? He would not catch
They
on for a
send
while.
out subtle hints.
That is cool.
Yep. My husband doesn't
Uh-oh.
always get those
Look,
hints, though.
uh-oh. She's going to be stopping by going, here's my list.
They will
Eric.
make a wish list and get the emails, phone numbers, send out texts, whatever they need to do.
Oh, that's fun.
I don't think my husband's caught on just yet.
My husband's responsibility, you're not my mother.
Yes.
You're not my mother.
I've heard that too.
And I go,
But
mm,
mother to
you
your
might
child,
want to think about it.
which is to me is more important.
I'm the reason.
So do you have an inkling feeling?
We're going to poke until we find.
Yeah.
Are you
I'd say
carrying
it's
this
another
baby
boy.
different?
Minus that I was really sick initially with this one and I wasn't with my others, but otherwise, now that I'm over that, yeah, just feels all the same.
I had 4 boys, and I knew.
Do you really?
I knew with all of them they were boys.
Really?
And like the last one was the only one that they were doing, like where you could do the testing early.
Oh, yeah.
The sneak peek, I think they call it, and I did it, and I was like, I don't even know why I'm doing it. It's a boy. Like, I'm very content with it being a boy, but I just knew with all of them, I still found out. There's no way I could
I say
not.
it's a boy.
I actually read a
team
book
boy.
on how to have a girl because I only wanted a girl. Is that terrible? I can't remember the name of the book. I gave it to my niece because she had already had 4 boys and she wanted a girl. And I said, read it, it works. Or at least I think it worked. I have a girl.
Yeah.
Wow.
We don't have a preference, so that's kind of why we thought
Yeah,
just
that'd
as
be
a
nice.
surprise.
Yeah.
Yeah.
So
I
are-
kind of felt like we would have a
You
boy
have
crew.
baseball team or
Yeah.
A protector for the girl.
Yes.
So, are you going to in the hospital after she's born have the reveal with your family? Like, come in and guess what it is?
I really thought that
That
far.
would be
My
so
friend just
fun.
actually did the same thing. She didn't find out
I
what
couldn't
she
do
was
it.
having.
I couldn't
And
do it.
I
when
think
she
she's over it.
posted the hospital pictures, like because you can't tell.
No, because they
You
put them in
can't
all
Yeah.
same
So
colors.
she had 2 little blackboards. She had one with girl, the name that she
Uh-huh.
picked out, one with the boy name, and so she put, the baby beside both of them,
that's
and
a
then was
cute
trying to
idea.
make people pick, and it was a little girl. She was really cute,
should do that.
and she had a boy and a
I'll
girl,
make
but
them
it was very cute.
That's sweet. I'll have to look at some ideas.
Do you
Yeah,
have
no, we
names for
haven't.
both?
Mhm.
Okay.
I need to tell my nephew that they're having their first child, I think in July, and they're not going to find out.
Yeah.
They want it to be a
That's-
surprise, and it's
like the-
killing my
it's
sister-in-law. She
very
goes,
popular right
"This
now.
is not fair."
That it's got to be. It's going back towards
Well, I think gender reveals got so.
Out of craziness.
Yeah.
I've
So
been
it's like I don't want to know, so I don't feel obligated to do
to
all
share
the things.
to share all the stuff going on.
Oh
You're
no,
too
I
busy
get it.
with
I'm
two
an
little kids.
overthinker. I have ADHD anyway and overthink everything,
Right.
so I could tell you it wouldn't.
It wouldn't work.
Not. No, it wouldn't.
I was trying to look
Mm-mm.
way before it was time to look, so I wanted to know.
Well, I knew. I
No.
mean,
Yeah.
we read the book. I read it like I don't know how many times, and she was a girl.
That's funny.
And then we went and they did the sonogram because 29 years ago, sonogram. So he said, "Girl, listen, I already knew." Okay, moving on.
No surprise.
No surprise. Oh, she was a surprise. No, I'm kidding.
Yeah, them
My
girls.
gray hair. She's a surprise. No,
Which
I'm
I
kidding.
say,
She's a-
I'm team boy, but I say she needs a girl. Everybody needs a girl.
I don't believe that.
It's not fair to the
My
rest
I
of us.
don't-
sister has
I don't
2 girls,
think-
and then I have 4 boys,
Okay,
and
you've
I'm
got nieces.
100%.
She's a boy mom.
I'm just
I'm
saying,
a boy
everybody,
mom.
everybody. It's not fair. Everybody
Like
needs a
Jesus
girl.
knew
Nobody needs
ahead of
that.
time I would be in jail, she would be in jail, somebody would be in trouble.
I wasn't
It
gonna bring
would-
that up. I'm glad you did because I was like, yeah, it would be good for you to have a girl. You kill somebody.
No, because boys, they love their mama.
Yeah.
They
It's a
100% love their mama.
different-
And
It's
they
different.
don't disrespect mama like girls will. And I know, because my mom had 2 girls. Me and my sister,
Yeah.
we were ruthless.
All I'm gonna
so.
say is preach it.
No. But now, but with
'Cause
boys,
I've got
there
one of
are
each,
things
so.
though, because
Yeah.
I've had mine fist fighting in the yard,
Yes.
and like at one point I thought one had broken the other one's jaw, and so I whooped
Oh.
all 3 of them because there was
Just
only 3
line
at
up.
the time. That's the ticket right there.
Yeah.
You whoop them all. Like if one
They all
person
get in
does
trouble.
anything, I used to tell them I would whoop every one of them, and I would always start with the littlest one. So by the time I got to the bigger 2, they were bawling and squalling. So they were like, no, and then
She
it got
had
to
it
where I
planned-
didn't
she
have
had
to.
a- I had it
Oh
planned out.
Lord.
But I told them one time, like they were over a water slide, and I said, if his jaw's broke and I have to take him into the emergency room, they're gonna take y'all away from me. Like I had them terrified, so they stopped doing that. I said, they're gonna think I did it.
4 boys though, that's
Yeah.
gotta be.
Oh no,
rough.
the youngest one's gonna be the run for her money.
Well, So they're 21, 19, 16 now, and 3.
Oh my gosh.
and the youngest one rules the nest.
Yes.
He does.
Yeah.
Yeah.
was
But
a
he's
COVID
cute.
baby
He's a
then,
cute
yeah.
Well,
one.
my youngest one is 21, so.
Yeah.
mm,
I will be in my 50s up and down the bleachers and stands
okay.
chasing him. So
Okay.
You will make it.
We'll
You will
see.
make it.
we'll see. And then the oldest is married, and he's been married a year, and I've just begged them, y'all just let him get in kindergarten. Let your little brother get in kindergarten
Before
before
you
you
have
start
a
having
grandbaby.
babies.
Oh,
Please,
Lord.
just let me get them all in school.
That's so funny.
Oh Lord, being a mom
Yes.
these days,
Yeah.
it's always a challenge, but we survive somehow, some way.
Some way.
Some way. Now you have 2 already,
Mm-hmm.
so you're 3rd, and you have 2. I guess I'm the
So
minority.
how old
one.
are the 2 that you have now?
4 and 2.
Aw.
So that's how my all of the older ones were 2.5 years apart.
Yeah.
So, and they were a good age difference. They still like to play with each other, and
Close.
They're
but
sweet.
not-
They're
yeah.
sweet brothers. They were
Yeah.
playing with magnet tiles this morning, building a racetrack before we left.
Aw.
Together.
Yeah, together. So it's the
Yeah.
sweetest. They're my biggest blessing.
Aw, that is always sweet. I'm one of 6. That's why I had one.
Wow. Where are you in the?
I'm next to the youngest. I'm the baby girl.
Okay.
So we range, well, my oldest sister's passed away, but I have a 70-something-year-old brother, and all the way down to my youngest brother is 50, he's 55. I had to think about it for a minute, so we're all about 3 years apart.
Right.
Not planned, but
I don't know
it
how
just
they
happened.
used to do it back. My grandmother was one of 12.
Oh, yeah.
And when they got to, she was at the end, I believe, and when they got to her, she didn't even have a middle name. I think they just.
It was like, just here, kid, get a
Just
name.
here.
Grab a name.
It's like, we're
That's you.
done. I was like, are you
With-
serious?
With 12 kids, I'm sure it doesn't matter anyway,
It
because
didn't
it
matter,
ends up
right.
being hey you, because even at my house, I go through every single name till I get to the right one, and now we're even throwing dog names out there.
Yeah.
So, I mean, I have 2 male dogs too, so, I mean, whatever, you know who I'm talking to, come on. Get
My
yourself
dad
You
together.
are
had-
the only girl.
My
I
dad
have a
had,
3-pound chihuahua,
oh, yeah.
and she is
Oh.
my, yeah,
Okay.
it's me and her. They call me
Against the
the
world.
queen and my little minion, because she just perches on my lap, and we
Like-
just
Manage
the
the
kingdom.
chaos.
My father gave us all nicknames, so
Aw.
we went by nicknames. And I really thought that was my name when I went to school.
Well, let's hear it.
Ugh.
You done said it. Let's hear it.
Doodab. I don't know why. But I got to class and they asked me my name and I said, Doodab. And they're going, that's what's showing on the paper. I'm like, but my sister's name was Push. We don't know where that came
Oh
from.
no.
Because she always like a cat, is what he said.
Mhm.
What's a cat? Push.
Right.
And I'm like, whatever.
Right.
So now some of my brother's names I can't repeat. But the boys were always in trouble. When I got in school, especially high school, oh, you're one of them. And I go, no. Because they knew my brother's names. And I'm like, oh, Lord, here we go.
Yeah, they were already judging you.
They were. It was harsh.
That's.
But my sister was 3 years older than me, so it was like, maybe she did better than me sometimes.
Yeah.
But I was one of those kids. I'm like, yeah, that's one of us. And there's one after me, too.
I
Get
think
ready.
that's a dad thing because he nicknames everything. My daughter's she's probably got 5 nicknames. The dogs have nicknames. Nobody gets called by
Their real
their
names.
real name.
No, my dad always called everybody nicknames. I didn't know my dad, so my dad has passed away, but his real name, legal name that his mother gave him was Dudley Byers. And I'm like, so they moved into our home when he got really sick. And I kept looking at stuff going, Daddy, who is Dudley Byers? And he goes, that's me. And I go, because my oldest brother's name is Dudley Byers. And I'm like, but why do you have Dudley stuff? And he goes, that's not. I go, well, who is it then? He goes, it's me. And I go, your name is Douglas. He goes, well, I changed it. I said, legally? He goes, not really. But it was on his driver's license. I'm like, how do you do that?
Just start telling people, I
He
guess.
did. He goes, I'm Douglas. And I go, but your real name is Dudley. He didn't like it, so he just changed it. Of course, my oldest sister went to court and got her name changed legally because she didn't like her first name.
Uh-oh.
It was a good one. It was a good one. Her name was Fanny Darlene.
Oh.
So
That was so
when
nice.
my daughter was little, my sister would get Shelby to say, "What's your mama's name?" And she called me Fanny Deborah. I said, "Oh no, that's your aunt's name."
Fanny Darlene and Fanny Deborah.
I said, "Nope, because we had a great aunt named Fanny. She never had children, and it was an honor." But yeah, my sister went
Well, I
legally.
don't know. I can see people using that name nowadays because they're really getting
Oh yeah, back to
different.
the
back to the old and very different.
yes. I have a niece named Ruth, which
Mm-hmm.
It's a very
old name. Henry. I have a nephew named Henry.
Yep.
So all those older names,
Yep.
which
My
I think is
grandson's
good.
name is Walt.
Oh, that is an older name.
Walt. Mm-hmm. And the new baby's Audie.
Audie.
Walt and
that's
Audie. And
cute,
those are
though.
there's older,
Oh,
different.
old
Yeah.
names.
Mm-hmm.
I know when I was
Job Henry.
Oh, yes, I like it.
Yeah, so everybody says Job, and I'm like, no, it's Job.
Job. I may have been one of those people. First time I said job. I know when I was pregnant with Shelby, my mother-in-law and my mother both said, please don't name them after us. And I'm like, why? Because my mother's name was Belva Jean. She goes, it sounds like you're burping. Belva Jean. And then my mother-in-law was Ethel. And she goes, please do not name your child Ethel.
Right.
Yeah.
But I'm like,
Well, Shelby's probably glad you did.
no,
No?
I really think Shelby would have been honored to be named after. My mother passed away when Shelby was very, very young, so she remembers things. But her grandmother Ethel, they were like 2 peas in a pod.
Oh.
I mean, two bees in a pod. Everything, they did everything together. Even when Shelby lived out of town, they'd stay on the phone for 2 or 3 hours. I'm like, when I didn't want to talk, I'd call your grandmother. She wants to talk.
This is our Mother's Day.
Yes, we're just going to talk about children. It's coming up.
That's right. This is
It's
our
always
Mother's Day
good.
edition.
Yes, yes. Dads, we'll have something for you too.
Maybe.
Short, sweet.
Maybe we should have Eric and Gerard on at the same time.
Yeah.
That might be interesting. Ooh.
We may need to bring the chaplain in when we do that.
And exorcist and everything else.
Yes, give their dads
Yeah.
their praise.
Oh, I
Was
know.
that June?
June 16th. It's my due date.
You know all the
Oh,
numbers. You're
She's
good.
got it all planned
Yeah.
out.
You don't have to get a present, just get a baby. Here you go, honey. Here's your present.
Lord willing, it'll come on.
Well, it's your third though, so
They probably won't come
I
in.
bet you won't make it
Got
all
a
the
college
way to
graduation
We
on
can
Mother's Day. Who does that?
Somebody that don't like mothers. I'm just
I
kidding.
guess. I know the college didn't.
They want to make sure their kids were with their mothers.
I think
There
so.
you go.
They're going to
Guess
show
so,
up.
But that's okay. I'll be with my kids. So.
There you go. They made sure it was going to happen.
Yeah.
Well, guys, it's been a pleasure having you guys.
Thank y'all for having us.
Well-
I think this is great that y'all do this, and it's a lot of good information for the community, and we appreciate y'all letting us come and
We appreciate it.
share what we do for the community.
So I'm gonna let you close out with your location, your address, telephone numbers. You pointed the
Yes. So Red River Pharmacy, we're at 1550 Moores Lane. The pharmacy main phone number is 903-792-7435. And then Red River Health, we are located inside of the pharmacy, and our direct number is 903-792-9124.
That's
You guys
awesome.
are welcome to call and talk with
Yes.
us. We can tell you more about it. You can come up there and look, see the pharmacy, see Red River Health. If you'd like to see, if you're already getting infusion somewhere and you'd like to come see.
So if they don't have a
Our
pharmacy,
suite.
can they just have Red River Pharmacy be their normal pharmacist? Okay.
Well, no, like you mean like a retail, like a normal?
Y'all don't do that?
No,
Okay.
no, it's just specialty.
Okay.
Yes.
I'm glad we clarified
Yes,
that.
yes, yes.
So
yes,
that's
yes.
good. Well, this has been Wellness Wednesday. We appreciate y'all tuning in and listening to our craziness
Yeah.
and getting
We
good
went all over the
information.
place.
Good information about Red River Pharmacy, another locally owned company. I'm Deborah.
And I'm Rachel.
Bye.
Bye. Thank you.
Choose excellence in healthcare. Choose Retreat Healthcare Services.